I did my project on myocardial infarction and congestive heart failure. These diseases both involve the heart and are similar but different in a few different ways, which I'll show you as we go through this presentation. Now, I'd like to first start off with myocardial infarction. Myocardial infarction is another term for a heart attack, which is kind of what we tend to call it. It's most commonly caused by a blockage of the coronary blood vessels. Now, what are the coronary blood vessels? The coronary blood vessels carry blood to the heart muscle itself, because without blood supply, we know that muscle tissue dies. Well, the cardiac muscle is no different. So what happens in myocardial infarction is we see that no oxygenated blood is being brought to those coronary blood vessels. The heart muscle begins to die, which makes it very difficult for the heart to pump blood to the rest of the body. We also asked the question, who's more at risk for this? Is there a specific set of patients that we can see that will be at a higher risk for this? And the answer is yes. We typically see this more in geriatrics, as well as people with a history of hypertension, hyperlipidemia, hypercholesterolemia, and previous heart problems. So some major risk factors for myocardial infarction are, again, prior heart-related problems, sedentary lifestyle, not exercising at all, diet high in cholesterol, smoking is a big one, long history of smoking, hypertension, or a recent chest injury. And here we see the gross anatomy of a heart attack. On the left side here, we have a healthy heart, and then on the right side, we have one that's going MI. And right off the bat, you can see a few key differences. That being that over here, the flesh is nice and pink, red, because this is all being oxygenated with proper blood flow through this healthy artery. Whereas over here, we see this purple bluish area, and what that is the effects of an MI. And it's being caused by a blockage in this coronary blood vessel. It's worth noting, by the way, that these blood vessels are very small when compared with other arteries like the jugular vein arteries. It's just in terms of other arteries, these are very small, so it's very easy for them to get clogged up. So what happens here is that we see a lot of that dead muscle tissue, and that dead muscle tissue isn't able to function properly. And here we see what happens at a molecular level. So over here we have histology of, pardon the interruption there, apparently I had run out of space on my computer. So as we continue, over here on the left we see that we have histology of MI tissue, and over here on the right we have normal healthy heart tissue. Now there are several different, there's one key point that I want to make about the difference between these two slides. The first being that on this slide here we see something called an intercalated disc. And over here on this slide we don't see any of those intercalated discs. And that's because during an MI those intercalated discs are destroyed, which is disastrous for heart muscle tissue because those intercalated discs are required for the muscle fibers to communicate with each other and fire in accordance with each other. So the loss of those, the heart muscle tissues just kind of start sporadically firing, which can leave kind of a vibrating of the heart, which we've deemed AFib, or VFib, depending on where it's occurring within the heart. So now on to some signs and symptoms. So signs and symptoms, chest pain, which I've already talked about, is due to a buildup of lactic acid. Patients also have reported dizziness, shortness of breath, cool and calming skin. You can see that they have bluish lips. And this is all a direct result of the heart not being able to pump blood effectively. Again, dizziness, if the brain's not getting enough oxygen, it's going to want the body to lie down to increase blood flow to the brain. So it's going to make you feel very dizzy and eventually bring you down. Shortness of breath, there's not a lot of gas exchange going on in the lungs because, again, well, I mean, it is going on, but it's not being moved, so you're going to start breathing a lot quicker in order to try and get that to speed up. It's the body's natural reaction to it. It's called a hypoxic drive. And then we have cool, clammy skin. Again, the skin isn't having an adequate blood supply, so it's not going to be kind of that pinkish color that it normally is. And again, same thing with the bluish lips. It's the hypoxic drive. The body is not able to um, pump blood effectively to extremities, and especially the lips, where you can see it. So, diagnosis. How do we diagnose an MI? Well, it's usually diagnosed by a lack of a pulse or an unconscious patient. That's usually done by a first responder that comes in. They'll, try and talk to the patient. If patients are responsive, they'll take a pulse, and if there's no pulse, they instantly assume it's an MI. But another really good way to see if patients had a myocardial infarction is lab results, which test the serum levels of T3 and T4. T3 and T4 are part of the endocrine system, and they're released only during destruction of cardiac muscle cells, which makes it really good to analyze. Because if those muscle cells are destroyed, again, that T3 and T4 are going to be in the serum where they aren't normally found. So that's how we can tell if somebody's had an MI. And then, how do we treat an MI? Well, I mean, first and foremost, an MI is always considered an emergency. Patients are rushed to the surgery, oftentimes to remove a clot. Other times they're not, because it's not picked up on right away, but they're monitored closely, and usually they have to have that clot removed. So once the clot is removed by a surgeon, they kind of have two options. They can either implant a stent, which will, it acts as a balloon. Actually, I have a picture of it here. It acts as a balloon, and what it does is it fills up this whole space here. It kind of pushes out that mesh, that little metal mesh that we see here. And that's going to keep the blood vessel open, or the coronary artery open. And this allows blood to flow through it normally, so that that heart muscle tissue can get the blood supply that it needs. Another option is bypass surgery, which they literally take the blood vessel and they bypass the area of the clot altogether. So some complications. If left untreated, and mostly commonly results in death. If your heart, isn't receiving the adequate supply of blood and can't pump blood to the rest of your body effectively because it's not working, you're probably going to die because your brain is not going to get the oxygen it needs. And because during this disease, patients have a lack of oxygen to the brain, it can result in memory loss or a loss of general motor, we call it macromotor, or fine motor functions. And once you've had an MI, you are at a much greater risk for having a second one, because again, your heart tissue has kind of died, and if you come back from it, that's all well and good, but you're at a higher risk because there's been so much destruction that you're at a much higher risk of having another. So how do we prevent it? The best way to prevent an MI is to live a healthy lifestyle. A low-calorie diet, exercise, also avoiding smoking. Smoking plays a large role in myocardial infarctions. We see a lot of patients coming in that have a previous history of smoking that also have an MI. So smoking is a big no-no if you're trying to avoid an MI. So what's the prognosis look like if after they had an MI? So it can vary. If somebody hits the floor and they're brought back immediately, their prognosis is it's pretty good. Maybe they don't have any brain damage, and they walk away from it just kind of learning that they need to lead a healthier lifestyle. Other patients aren't so lucky. Some patients spend a great deal of time unconscious with blood not being able to be pumped to their brain, and that's where we see the loss of motor function, the loss of memory, other brain issues. So it can vary. A lot of patients do make a full recovery. Never have, not everybody, but never have an MI again. Some people have that. It's a one-time thing. Other patients aren't so lucky. So there's a kind of a broad spectrum of possibilities with this disease. So the case study that I analyzed for an MI was a 53-year-old white male. He began feeling chest pain when he was playing tennis with a friend. He had a past family history of MIs. His father died of one. He was a 40-pack a year smoker. The patient initially came in and nothing was done. He was kept overnight, and the next day he began to feel ill again, and they found that he had a 95% obstruction of his descending coronary artery, and which was eventually removed, and he wound up surviving. So, case study questions that we had: can we cite 6 risk factors that predispose the patient to acute myocardial infarction? Well, the first and foremost, he had a past family history. He had poorly controlled hypertension. He was chronic stable angina from SPAMI. He was a 40-pack a year smoker, which is a very big one. He had hyperglyceridemia, so he had a very high glycerol count. He had prior chest angina on and off for a week. Now, chest angina is chest pain, and it had been, again, on and off for a week, so he would occasionally get it, and it wouldn't. That's a huge, huge risk factor. Which kill class is a myocardial infarction? He was in the class 2 due to the rails in his lungs and the S3 elevated venous pressure, which was found during some of the testing that was done in this case study. And then I got into what kind of medications he was on, for which condition is this patient taking amlodipine. He's taking it for hypertension. For which condition is the patient taking glyburide? He was a type 2 diabetic. And for which condition is he taking gemifibrazole? Hypertriglyceridemia. So again, the triglycerides, which were a huge risk factor for him. And that concludes myocardial infarction. I'm now going to move on to congestive heart failure. So, congestive heart failure is when the heart is able to successfully pump blood out of the ventricle, causing a backup in the atria and subsequent body system, which can be pulmonary or systemic, depending on which side of the heart we're talking about here. Etiology most commonly caused by decreased function of the bicuspid and tricuspid valves, which allows backflow from the ventricle to the atrium. Anyone can have congestive heart failure. However, it most commonly affects people with obesity. Some risk factors: hypertension, hyperlipidemia, atrial fibrillation, peripheral artery disease, and coronary artery disease. So, coronary artery disease, we just talked about that. That's myocardial infarction. That puts you at a huge risk for congestive heart failure. So we kind of have a gross mechanism here, and I mentioned that it could be due to the improper function of these valves here, but it can also be due to the narrowing or widening of the ventricle itself. So here we see a normal heart, and we see the ventricle, which is going to pump blood out, which is that's all well and good. But then we see the dilated ventricle down here. And what's happening down here is it's more blood for this to pump out with less muscle tissue, which doesn't typically bode well for the heart. So we see reduced volume flow, which is, not great. And the reduced volume flow, but with this being still full, blood will back up in the atria, which is not ideal. Then we have the mechanism of cellular mechanisms. So this is actually of the fibers in the connective tissue between the heart muscle fibers. And what we can see here is that there's very little destruction over here in B. And then over here in A, we see that there's a lot of destruction, very thin fibers, which is, not typically what you want to see. You want to see something like this, where the fibers are thick and they're flourishing, and everything just really looks good in this picture here. Whereas this picture, everything's really kind of This isn't what you want to see. So some signs and symptoms. Um, Again, it depends on the side that it's coming from. If it's left-sided and blood's backing up into the pulmonary system or the lungs, you might see some red frothy sputum, difficulty breathing. Um, if it's on the right side, you might see some swollen hands or feet because then blood's backing up into the body circuit. You almost always see dizziness and fatigue on both sides, and all signs and symptoms are related to the heart's inability to pump blood. So, diagnosis. How is this diagnosed? So, it's typically diagnosed actually with a stethoscope because you can listen to kind of the lub-dub of the heart. And when you listen to the lub-dub, you can actually hear the sound of the valves closing because the lub-dub is the valves opening and closing, which is actually pretty cool. It's also diagnosed by swelling of the hands and feet or x-rays showing fluid in the lungs. So, how is it treated? So, for left-sided, it can be treated with CPAP, constant positive airway pressure, which allows the fluid in the lungs to kind of be forced back into the bloodstream, so that we're not drowning in our own blood, which is kind of gruesome. Um, it can also be done with beta blockers, better diet, quitting smoking, because again, smoking's kind of a big deal in any heart condition. A vasodilator, so something to kind of make the blood vessels dilate a little bit, so it's easier for the heart to pump blood out, and heart medication, which can be a wide variety of things. But for this one, we really want something that's going to make the heart be able to pump a little bit more effectively. So some complications. Left-sided, you're going to have difficulty breathing because, again, the fluid's backing up into your lungs. You won't be able to sleep lying down because that will cause the fluid to build up in your lungs. So you got to sleep upright, and you have to have a CPAP mask on. So it's not really ideal to live that way. Right-sided, blood pressure medications to increase blood pressure to your extremities so that you're not going to get that swelling, backing up of blood. Decrease blood pressure. Vasodilators, again, to decrease the blood pressure and so that the heart can pump more effectively. Beta blockers, and again, diet. Diet's going to be a big one. So, how to prevent congestive heart failure? It can be prevented by living a non-sedentary lifestyle and having a healthy diet. Wow, look at it's almost like congestive heart failure prevention and MI prevention are one and the same because they can also be prevented by not smoking. That's one of the similarities between these two diseases, but we'll get into that more in a second. So prognosis, you can always live a decent life with congestive heart failure. You gotta take some form of medication for it. And again, yeah, some sort of medication. You always have to undergo some sort of form of treatment for left side CPAP. Right side, I've seen people wear different stockings to help, keep the blood out of their ankles so they can walk. Um, it does affect the quality of life a little bit, but with proper management and proper treatment over a long period of time, the quality of life effects are pretty minor. For the case study, we analyzed a 69-year-old female come to the hospital complaining of a racing heartbeat. The patient was overweight, increasing shortness of breath over the past 2 months. She had severe breathing problems over the past 2 months. She was a former smoker and a heavy alcohol abuser. Fun fact, she had an MI 2 years prior, so there's some connections there. The patient was diagnosed with congestive heart failure. She wasn't having another MI, and she wound up, being fine. But again, this just kind of goes to show that an MI or a previous heart condition can lead to congestive heart failure. So, some case study questions. Based on the limited amount of information given above, do you suspect that this patient has developed left-sided, right-sided, or total? So, based on the information that was given during the case study itself, I suspected that the patient had developed total congestive heart failure, and I suspected that because during the reports that came in, she had very high blood pressure, she had swollen ankles and swollen wrists. She was also having a lot of trouble breathing, which is how I arrived at the total congestive heart failure. She had to sit up at night. She had edema in the extremities. Left side congestive heart failure causes blood to back up in the lungs. The patient presented both symptoms, which led me to believe total congestive heart failure. What is the likely cause of the patient's heart failure? Again, she was a previous smoker. She was overweight. And she also had a family history of it. Family history of hypercholesterolemia and atherosclerosis, which is the buildup of plaques and the high cholesterol, which probably put too much pressure on the bicuspid tricuspid valves. Why is the patient taking allopurinol? The patient has been diagnosed with gout, and allopurinol is a medication frequently prescribed to patients with gout. So let's go over some comparisons real quick. So the similarities between congestive heart failure and MI. There's an increased risk if you smoke, drink, have a sedentary lifestyle, or a poor diet. Both lead to breathing problems. In congestive heart failure, only left side leads to breathing problems. Both are a result of vascular dysfunction, so the blood from the heart isn't being pumped properly, which is true for both. Both have symptoms that result from improper blood flow. So again, the improper blood flow from the heart to the target tissues is causing a big problem for these people. Now let's go over some differences, because there are some differences. MI is caused by a blockage, which is kind of a big thing. It's kind of the whole idea behind the disease is caused by a blockage in the vessel itself. But congestive heart failure is caused by a backflow or widening or narrowing of the ventricle. So there's kind of a difference there, whereas MI, there's something that's actually blocking blood flow. In congestive heart failure, it's because of the heart muscle itself is just not able to pump. MI causes cardiac tissue death, whereas congestive heart failure causes edema. It doesn't typically cause tissue death, it just causes edema of the tissue or swelling of the tissue, which can lead to death of the tissue, but it's not as direct as myocardial infarction. MI can be treated surgically, so MIs can be fixed pretty rapidly. Congestive heart failure has to be managed over a long period of time. These are my citations.